some of the companies are shown here, as well as this new phrase we like to call the Band-Aid, which is the use of artificial intelligence in medicine. So, of course, I need to give some disclosures in the beginning of this presentation that I have a financial interest in some of my startup companies whose work I will present here in this brief talk. So, as you know, my last name is Webster, so I suppose that means I love definitions. So I wanted to put up here the Webster's Dictionary definition of artificial intelligence. And artificial intelligence, of course, is intelligence perceived, synthesized, or inferring information as demonstrated by computers, computer software, algorithms, as opposed to intelligence up here in a human brain or other living organism brains. Now, I would say most of us have a negative impression of artificial intelligence. ChatGPT, for example, in the academic world, has led to a lot of students using artificial intelligence to write their papers. So put all that negativity aside because I'm going to present some positive impacts that artificial intelligence can make, especially related to healthcare. And I love starting these talks with a list of problems in our healthcare industry. So I'm going to show you a list that we've come up with that I believe can be solved through artificial intelligence. And here's my list. I put a box around some of those areas that particularly could be solved through the proper use of artificial intelligence. And as we all know, if you look globally at our healthcare system, we have overcrowded hospitals, barriers, geographical, economical barriers to get into a healthcare setting. We also have medical devices that fail. We tend to treat every patient the same, and we largely have a reactionary healthcare system. You have a problem, you go in for healthcare help, and we react to your problems with a pharmaceutical agent, with surgery, with whatever it might be. So, in particular, I think these areas of our healthcare system can be improved through artificial intelligence, which I will talk about in this presentation. So, first and foremost, I would make a strong argument that our traditional medicine is not based on artificial intelligence. I think we all could agree that through the past century and longer, we have not used predictive computational modeling to help human health. Rather, our healthcare system has been very static. Let's look at what your blood pressure is. Let's do a blood test and analyze it for various chemicals, and then make a decision based on that input. Artificial intelligence is really predicting through computer algorithms, through your patient healthcare history, your family history. Let's predict what could happen to you and let's come up with a treatment, a therapy now so that those problems don't become healthcare problems in the future. So I do have a long history of looking at static healthcare, medical devices, and we have a long history of taking medical devices off the shelf, nanotexturing them, using approaches that can decrease infection, improve tissue growth. So on this slide are just several of these efforts where we've used 3D printing, created nanotextures in spinal implants. Those nanotextures we've seen can improve tissue growth and reduce infection. In fact, we have technologies and implants that are in over 40,000 patients that have shown no cases of infection, no cases of implant failure when creating these nanotextures on these static, non-AI generated implants. We also have research where we've created nanotextures on amputee devices. Here's a rat model that shows a screw that's been created to have nanotextures that can improve tissue growth, reduce infection when creating these nanotextures. We've also created nanotextures on orthopedic soft tissue materials like ligaments, tendons, cartilage. And when creating those nanotextures in sheep models, we've seen the regeneration of orthopedic soft tissue. Vascular tissue, not just orthopedics, but even in vascular tissue. You can create nanotextures on stents, on polymers used to regenerate arteries, and we see increased regeneration of an artery. Catheters, creating nanotextures on catheters to decrease infection, and even materials like biodegradable metals, magnesium oxide, we've been able to create nanotextures to improve device performance. So we have a long history of really creating successful implants now in humans that have zero cases of infection and zero cases of failure. And here are three of our most prominent examples. Again, pedicle screws in the spine. We've created to have nanotextures, silicon nitride based laser etched nanotextures. We have seen in 4,000 patients no cases of failure. In foot screws, we've seen calcium phosphate nanoparticles eliminate the degree of failure. So no cases of infection, no cases of failure. As an academic, I've spent a lot of time looking at these nanotextures. And again, this is not related to AI. This is our history of using nanotextures where we can mimic nature in these nanotextures. If you look at an insect wing, it has nanotextures, and those nanotextures on insect wings have been shown to inhibit bacteria growth. So we're simply borrowing in this research what's been done in nature. Let's put it on a synthetic implant, and we are seeing the same thing in humans, that nanotextures eliminate infection or bacteria attachment. You can also look at, for reasons why these nanotextures work, at biophysical models. Things like finite element analysis, where a cell membrane, a bacteria cell membrane, is too stiff to attach to these nanotextures, so it repels those bacteria. We've also looked at surface energy as a reason why nanotextures inhibit infection. So here's an example of PLGA that's been micron textured and nanotextured. And when we look at protein interactions on these high surface energy materials, we see fibronectin absorbing in much greater amounts, and in fact, much greater bioactivity when these proteins adsorb. So surface energy makes a big difference when using nanotextures to eliminate implant infection. And here's, of course, a diagram that shows you have an implant surface with nanotextures. Unique surface energy can attract the absorption of proteins like fibronectin, as shown here, other proteins, mucin, casein, that can repel bacteria. And I don't have time to talk about this, but we've even generated an equation. This equation can predict, using AI, how you implement nanotextured features. What are the sizes of these features that should be put on an implant to attract the absorption of proteins that can inhibit or keep infection from occurring? So yes, we have moved into AI, as I will talk about, in terms of computational models to design the right nanotexture for you, the patient, depending on your history of infections, your likelihood of getting infections, and let's create the best nanotexture to ensure implant success. And this is the crux of why these surfaces work. Here's two surfaces, and I'll show you a quick video. These are both titanium, 3D printed titanium surfaces. One we created to have a nanotexture that's hydrophobic. As you can see, the water drop placed on that surface, very hydrophobic. Another one, we've created that nanotexture to be hydrophilic. So you can see that specific nanotexture, different than the hydrophobic nanotexture, the water drop spreads. So same chemistry, difference of nanotexture changes surface energy, which changes protein absorption and can inhibit bacteria colonization that leads to infection. So again, we've been nano optimizing materials, implants for over 2 decades. And when we do this, we trademarked a term called nano optimized. We've worked with over a dozen different companies to really maximize their surface so that it can inhibit infection. And in the case of bone, increase orthopedic applications if that's what is desired. So let me go a little bit deeper into these FDA approved materials that are in humans today. and try to tell you how our next generation of approach is incorporating artificial intelligence. So, our most successful implant are the pedicle screws in spine. We use anodization to create those nanotextures, and anodization is a well-known process. It's used in car parts to reduce friction. It's used in silverware to make them more shiny. And yes, it's also used in medical devices to passivate the surface so that you don't have continual oxidation to occur. Here's our specific recipe to basically anodize titanium screws to possess nanotubular features. So here's a screw used in the spine. We follow that process and we can get nano textures. We have a plethora of in vivo data. And as I mentioned, of course, now we're in over 40,000 humans with no cases of failure. Here's our animal study where we inserted a screw into a rat femur, a rat leg that's been resected to mimic an amputee model. That screw, some of them were nanotextured through anodization. Here's the screw in this image of the rat. We saw that the rat was able to put force on this implant as short as 3 days after surgery when nanotextured. Without that nanotexture, we took this study out to 28 days. The rat did not put any force on that hind limb. When we looked at the exit site, so where the implant comes out of that resected leg, we could see the unanodized, the nano smooth implant, the wound was open, upwards of 28 days. The skin did not attach to that screw when it was smooth, when it did not have nano textures. That left an open wound primed for infection, inflammation, and that's exactly what we saw in our control conventional pin. That open wound led to significant problems. When we simply nanotextured that material, we were able to see skin grow up and attach to the screw. This kept bacteria out, stabilized the implant, and allowed for a successful material. And again, we are in over 30,000, closer to 40,000 now, implants in humans. And according to the FDA MAUDE database, none of these materials have failed, 0 cases of failure. But now I need to transition into AI because we created these surfaces just through anodization, not using any kind of AI modeling, not predicting the optimal surface for that material for that specific patient. So I firmly believe AI has a place in our healthcare system to optimize the surface of your implant. If you're more susceptible to infection, we can put that criteria into computer modeling and develop a surface that is more proactive at inhibiting infection because you're more likely to get an infection. Similarly, if you have a health history that you're going to have inflammation, a lot of scar tissue, we can use our equation, our artificial intelligence models to develop a surface that reduces chances of scar tissue. Similarly, if you're older and you have osteoporosis, your bones don't grow as well. We can use our AI models, our mathematical equation to predict the nanoscale feature that we should put on your implant to promote bone growth. So we are using AI in the next generation of nanotextured surfaces to tailor that nanotexture to what you need as a specific patient. We are also using AI in sensors. I'm convinced over the next 5 to 10 years, sensors will revolutionize healthcare. We've already started to see this in certain aspects of wearable sensors like my watch, which counts my steps, can determine my EKG, can determine my heart rate, but we are focused inside the body and using AI with implantable sensors to maximize the chances of success of a medical device. So there are materials used in medicine today that have sensor capability, but they do not use AI. A pacemaker shown here is a sensor. It senses how well your heart is beating, and if it's not beating regularly, it gives an electrical impulse and causes your heart to beat regularly. Today's pacemakers don't use AI. There is no computer algorithm that's used. There is no assessment of your history as a patient to predict in the future how this pacemaker should work. We also have sensors used in orthopedics. Most of these sensors are used for implant placement. So this green looking sensor here is a strain gauge, and an orthopedic surgeon will use it when placing this implant in the body to see if it's been placed correctly. Of course, there's no AI used in these types of approaches. Even in the watch that I talked about that can count your steps, determine your heart rate, there's no AI that is used in wearable sensors to try to predict problems that might happen an hour, 2 hours after working out in terms of your health. So, in all of these approaches, we are trying to go the next step. We want to develop in situ sensors grown off of implants that can both sense what's happening. Do you have bacteria around your implant? Is bone growth occurring? Do you have other inflammation problems that we should be concerned about? And then processes within the same sensor. And this is where artificial intelligence comes into play, where we can interpret what's happening in real time surrounding your implant with your patient history. It processes that information to develop a response. And that response could be if you're more susceptible to infection. And this sensor has indicated you have 10 bacteria on your implant, then we should intervene now. Our AI model says we should intervene now, and we should release an antibiotic, or maybe we should release a nanoparticle. So this is the complete sensor development, a sensor, processor, responder that we are developing in particular for orthopedic implants in a material we call the smart hip. Smart hip is we take off the shelf implants like this hip implant, we grow carbon nanotubes off of the surface. Those carbon nanotubes assess how many bacteria have attached, how many bone cells have attached, how many immune cells have attached. It then sends that to a computer processor with an artificial intelligence algorithm. Based on your patient history, it will predict how likely this implant will succeed or fail in the future. And if you're more, again, susceptible to infection and we determine there's a small amount of bacteria on your implant, we have a response. And the implant will release a nanoparticle or an antibiotic to fight that infection. Let me play this short video.
Smart Hip,
which
the
further
most
explains the
advanced
idea.
orthopedic implant biosensor and drug delivery system, integrating bone health monitoring and drug releasing ability. Increased life period and prevented bone implant failure. Sensing and delivery, control, and transponder working together and compose the system. Sensing and delivery. Carbon nanotube and conductive polymer coated at the surface of anodized nanotubular titanium. The specific capacitance voltage profiling on CNTs enable the sensing function. Control. A chipset beneath the TI implant collects the sensing signal, stimulates the polymer for drug release, and communicates with the transponder. Transponder. Integrated into an out-of-body device, which receives data for implant analysis and sends a prescription from the doctor to release drugs on demand to inhibit infection, limit inflammation, and promote bone growth.
So hopefully you enjoyed that background music, but that hopefully gave you a better idea of how we're developing this smart hip. An all-inclusive sensor senses what bacteria, cells are present surrounding an implant, quantifies and identifies those cells, processes that information using an AI algorithm to predict if implant failure will occur, and then responds, has an ability to respond to adverse effects to enable for a successful implant. So here's an animal study we conducted many years ago, which demonstrates the viability of these sensors. On the left is a control material. We forced an infection in this rat Calvaria model where we seeded bacteria on the implant, inserted into the calvaria of rats. After 7 days, you can see on these histology slides, yellow, that indicates bacteria. So clearly, there was no ability for this implant to resist bacteria growth. And in fact, we did see bacteria growth after 7 days. However, using our sensor, we were able to sense bacteria were present, and we then released an antibiotic, gentamicin, which will kill Staphylococcus epidermidis, to ensure no bacteria present 7 days after implantation. So we were able to salvage this implant even though bacteria were on it and were colonizing that surface. So again, if this were a real patient, we could intervene if small amounts of bacteria are present and your healthcare history puts you more susceptible for an infection. We have a way to keep that implant from becoming infected without removing it and reimplanting a new implant. We also have another way to create a sensor. You remember that past example was carbon nanotubes grown out of titanium. Well, you can also use a process called atomic layer deposition to grow sensors off of implants. Atomic layer deposition was basically born in the computer chip industry. So we are simply taking, again, implants off the shelf, growing using atomic layer deposition sensors to serve the same purpose. Sense the number of bacteria, the type of bacteria, whether bone growth is occurring, whether inflammation is occurring, and then we have an ability to respond to those adverse effects to salvage the implant if something negative is happening. Here's the surface of that implant when using ALD to deposit chemistries like TiO2. You can see at different temperatures, you get different formulations, different nanotextures of TiO2 using ALD on a titanium-based implant. And we've seen if you create that surface correctly, you can inhibit bacteria, significantly inhibit E. coli, Staphylococcus aureus, MRSA, the very dangerous antibiotic-resistant bacteria, can all be reduced without using antibiotics, but using nanotextures created through ALD. At the same time, you can increase bone cell attachment and bone formation using ALD surfaces, using the same ALD surfaces that reduce bacteria attachment. We've converted this into in vivo data where we took a sheep done at Colorado State University. Here's our sensors, the ALD coated materials with sensors implanted into the spine of sheep. We use TiO2 coatings, zirconia coatings, silver coatings. After 12 weeks, we saw greater bone growth surrounding these ALD coated materials, these sensors that we implanted into sheep. And we quantified that, and you can see the quantified bone attachment percentage, how much bone is growing around these materials on each of these ALD coated surfaces. So ALD is another way to grow a sensor off of an implant to be used in this context. And just in case I didn't make it clear, we are incorporating many aspects of artificial intelligence into our sensors using this Band-Aid concept where we're gathering real-time information, how an implant's performing in a patient, combining that with your patient history. Again, are you more susceptible to infection? Are your bones growing slower because of some genetic profile that you have? Or are you getting more scar tissue instead of bone surrounding your implant? Take that information with real-time information and develop a strategy to respond to adverse effects. That is the future of medicine, to incorporate your patient history and current data into a prediction of what happens to your implant. And I would beg everybody to see how far behind we are in implantable sensors. Sensors are used all over society. My car that I drive has over 400 sensors, but the thousands of hip implants that will be inserted today, zero sensors. We need to do a much better job of using sensors, and when we're using sensors, we have to consider artificial intelligence simultaneously. So let me leave you with one last example of how we're using AI in medicine, and this is with your cell phone. Use your cell phone to determine how well your implant is performing. Basically, what we're doing is we're using your cell phone to measure the temperature surrounding your implant. If you have higher temperatures, that's a problem surrounding your implant. It could mean infection. It could mean inflammation. If you have normal temperatures, that means tissue healing. So we conducted a study in India with over 1,000 patients who received knee implants. We connected your cell phone with a FLIR device. The FLIR device measures the temperature profile surrounding your implant. So here's the incision from the knee implant. We were able to do temperature profiles 4-day post-ops, 15 days post-op, and we could monitor how well that implant was doing. Again, if we saw increases in temperature, that could mean infection and inflammation. If we saw decreased temperatures, that could mean lack of blood flow, lack of healing. If we saw normal temperatures, that would mean normal healing. So we were able to communicate to the orthopedic surgeon, patients sitting at home, doing a temperature profile around their implant, how well their implant was performing. And we incorporated AI. We took images using these FLIR devices. Images are prime for AI interpretation. So we could take these images, take patient history. We had thousands of other patients that we had data coming in. So we had a comprehensive data set of these thermal images, which led to a prediction. If we saw increases in temperature, we could predict using these AI algorithms if infection was going to be a problem for these patients or healing was going to be a problem for these patients. So we can easily incorporate AI whenever we have images like thermal images to help assess patient progress or patient health. And I would also mention we're now entering a study. Again, we're doing this in India where we can look depth. We don't just have to look at the surface of your skin and do temperature profiles, but we can look into depth, look at tendons, look at muscles, look at tissue. So if you have a sporting injury and your knee hurts, we can take a thermal image and predict, did you tear a ligament? Did you have a problem with muscle strain? All doing this on the field, wherever you are. So you don't have to go into a hospital. We take all of our AI generated images and we can predict what those temperature profile mean for your health. So I hope in this very brief presentation, I was able to give you an overview that static nanotextures work. They are eliminating implant infections so far, knock on wood, that it will continue to happen, but we need to do much better. And we are pushing the field of AI, incorporating it into sensors, incorporating it into thermal images to really assess what's happening surrounding an implant to ensure implant success. I need to acknowledge funding sources. Certainly, my startup companies who have been involved heavily in these areas. And I'll give a shameless plug for 2 new books that I've written that have come out. One with Atit, who's also at the conference in Nano Sensors. Very happy that World Scientific has published this book, really highlighting this need for nanosensors and AI in our healthcare field. And I also published with Steve Zangana a book on how nanotechnology is being used to control your immune system. So thank you very much.